In this segment, I want to talk to you a little bit about a condition that, despite more popularity and more knowledge being out there, is still relatively unknown. It's what we call the female athlete triad, or the female athlete tetrad sometimes. And what it is, it's a series of interrelated conditions that some female athletes experience. My background was a fellowship in women's sports medicine, where we dealt with both men and women, but we dealt with a lot of issues that were unique to the female athlete. So the female athlete triad begins with low energy intake, and that simply means they often call it disordered eating, which is not the same as an eating disorder. An eating disorder is something like an anorexia or bulimia. Disordered eating just means not getting enough calories for your activity. A good example is you're a hardcore long distance runner and you take in 3,000 calories a day, but you're burning 3,700 calories a day. And physiologically, you probably feel okay, but you don't realize you're in a negative energy balance because you work out so much and you're probably not eating enough to keep up with it. Especially true with adolescent athletes who are growing quickly because they're burning so many calories. Well, when your body hits a certain point of calorie loss with women, what you start to find is they start to miss their periods. And we call it, when a female athlete misses her period for 3 or more consecutive cycles, we call it amenorrhea. Now, amenorrhea that occurs after you started your period is called secondary amenorrhea, which often means something's causing that. And one way you determine that is you do a series of labs to make sure there's nothing else going on. You know, is it a hormonal issue? Is it a genetic issue? We had one case where a lady had a pituitary tumor that was causing it. But in most cases, you find out when you look at someone's calories, you realize they're in a negative energy balance, and the body obviously is in basically starvation mode. And what it decides is that, well, I have enough energy to keep my body warm and keep the heart going, keep the muscles. I certainly don't have enough energy to have a baby. So basically, menstruation stops. Now, that's really important because people say, well, what's the big deal? That's probably a convenient thing if you're an athlete. Well, the problem is that means low estrogen. And one thing that estrogen is very important for in women is bone reabsorption. So the calcium you're taking into your body should be going to your bones for the most part. And especially for young women, there's a very critical period of time from about age 11 to about age 14, roughly, where you're absorbing most of the bone you're going to get for the rest of your body, for the rest of your life. That bone reabsorption stops at some point in your early 20s. And at that point, for the most part, you tend to have what you have. So if you're not forming bone in your formative years, you can deal with low bone density. I don't say osteoporosis because that's what happens later in life. But the problem is, if you have low bone density when you're in your 20s, later in life, when you're in your 50s or 60s, you're at a much higher risk for osteoporosis. I say tetrad because in some cases, there's a link between low estrogen and endothelial function. In other words, the ability of your blood vessels to dilate and expand. And there's a question down the line, are these young women, not now, but later in life, at risk for cardiac events? So the most important thing about the female athlete triad is education, education, education. It's a lot of education about what it means, you know, should your periods be normal, what are your energy intake needs, and teaching them like how to monitor that and take care of their bodies. Step 2 is doing a workup with some labs, and step 3 is seeing what you can do to try to fix that. Often it involves a nutritionist, it involves your primary care doctor, and also looking at other things that might be happening. A good example is if you're 19 or 20 and you're on your 3rd stress fracture in your one shin, and your 2nd one, your other one, and you start answering questions on the specific questionnaire that seem to indicate that your attitude about food is not what it should be, which usually means you're not eating the way you should be, we have to address that now. So a little prevention, a little education tend to go a long way with dealing with the female athlete issues.